Broadcasting from the business capital of the world, this is the Podcast Business News Network.
I'm going to be straight up honest and say that I'm not the biggest fan of the healthcare system here in the United States. Lots of reasons for that. So when I hear that somebody is a healthcare expense reduction expert, right away it piques my attention, especially it should for you if you're a company that offers insurance, uh, self-care insurance. Let's go over all of that. This guy helps companies all the time. Scott Hettesheimer joins us on the program. Scott, welcome. How are you?
Well, I'm great, Steve. Thanks for the introduction.
Yeah, it's great having you here. And this is a big deal in our healthcare system with companies, medical companies overcharging, a lot of fraud, a lot of waste, a lot of abuse. Essentially, when you work with a company, well, let's rewind. What type of companies do you work with to help them maximize and improve their healthcare insurance?
Well, Steve, we work with self-insured employers, and a self-insured employer could go down to, let's say, 10 employees. You have to run analytics and scenarios to see if that's going to work out best for you as a small group like that. But you can have a self-insured group of 10. I specifically target 100 and above, and there are some other unique things that we can do with employers that have 500 and above.
Wow. So when we look at this, the companies that they're using, the insurance companies that they're using, are their the names are mostly the ones that we know, or are these, uh, very distinct companies that are not well known?
The companies that are well known, I refer to as legacy carriers. And the definition of a legacy carrier, my definition that is an insurance company that is on the stock exchange. You can buy stock in them. So the legacy carriers, United Healthcare, used to be Humana, Aetna, Blue Cross, Anthem, all of the guys that you'll find on the stock exchange, they have shareholders, they pay dividends. And of course, they have to have profit to pay dividends. And something that people don't understand is, they think that when an insurance company has a claim to pay, that they're using the insurance company's money. Never do they use the insurance company's money. The money is your money. It's money that comes out of an employee's paycheck. It's money that the employer pays for benefits. So all the money that is used to pay healthcare claims comes from us, we the people. It doesn't come from the insurance company. Insurance company is just a middleman that manages the premium contributions that come in, and then the claims that come in, and the money that goes back out to pay the claims. So, in all instances, it's not the insurance company's money. Now, with that being said, this is very profitable for insurance companies. Just look at these legacy carriers that I identified and look them up on the stock exchange. Look at where their stock was 7 years ago and where it is today. It's quadrupled. Some of them have gone up 5 or 6 times in 7 years. Come on, how's that happen? Who else benefits from this? Well, it'd be the providers, hospital systems. 7, 8 years ago, look at the hospitals that were in your neighborhood. And then look at them compared to what they are today. These hospitals have evolved into campuses. Expansion, tremendous expansion. They put buildings on every corner. I mean, we used to see that with pharmacy, where there'd be a pharmacy on, a Walgreens, a CVS, and they're all across the street from each other. There's one on every corner. You'll find the same thing with hospital facilities, outbuildings. They all have specialty care buildings that are separate from the hospital, now built in your neighborhood. They're everywhere. How can they afford to build all these facilities? Well, a lot of them work in a nonprofit scenario, so all of these profits that they achieve with overbilling and I'm being polite when I say overbilling,
Mm.
it's reinvested into facilities to expand hospital services and put it almost in every neighborhood. So yeah, you just follow the money. It's there, and you can see what the problem is and where the money goes.
Yes, in so many regards. And as you're talking, Scott, I'm thinking about my area. I'm in a suburb of New York City, just outside, about an hour away. Try and find a hometown physician, local guy, just a little practice that cares about their patients and has for years. It's almost non-existent. They've all been swallowed up by these bigger companies, and they could be national, they could be regional, bigger medical companies. Same thing for dental firms. There's more, individual dentists, but a lot of those are getting swallowed up by bigger brands. So yeah, it's big biz and urgent care facilities, just about one in every corner. And so frustrating for those of us with insurance, paying our own insurance, because a lot of insurance carriers charge you more if you go to an urgent care facility. Instead of a $25 copay, you're dropping easy $75. So it's no wonder why they're opening up, because we're paying for it.
Right. That's a good observation, Steve. Um, you talk about the doctors and hospitals have basically purchased all these private doctor offices, businesses, whatever. Now most all the doctors are employees of a hospital system.
Yes.
And, you talk about the urgent cares and all these other facilities. Well, you see this when you go to the hospital when you have a surgery. And, when you get the bill, if you go through your bill, you'll see that you're being billed by 3, 4, 5, 6 different entities. You only went to one hospital. But now there's a separate bill for radiology. There's a separate bill for anesthesiologists. There's a separate bill for the surgeon. Remember, the surgeon is employed by the hospital. They all have different company names, but if you dig into it, most of them have the same federal corporate tax ID number, the same as the hospital. So that's how you know they're all owned by the hospital, a single entity, even though it appears that they're broken out into several different services. Now, there's a strategy. This is a strategy for administrators of these medical providers. They want to bill all these different entities because they basically can debundle your procedure. Your procedure is bundled, meaning that, when you go to the hospital and you have a surgery, you're going to have radiology, you're going to have anesthesiology, you're going to have all these different services needed. And when it's bundled, it's discounted. Well, now what they do is they unbundle so that they can each bill a gross dollar amount for services and eliminate that discount.
Mm.
It's I guess you'd say only in America. It's capitalism. I don't have anything against capitalism. I'm 100% for it. But there has to be some capitalism with checks. And
Yes. You know what? I completely agree. And that's what's missing. Even with a digital record system, and everything's digital now. Back in the day, it used to be paper. You would fax your medical records over to another doctor, medical provider. That has issues. And just to illustrate all of what you're saying here, Scott, I have a very close friend who works for a regional medical company. They own many different practices, hospitals, all of that. She's a medical biller, one of many. Do you know how many, what her quota is in terms of claims filed per day? Wait for it. Over 100. She has to 100 claims. This is one person. There's tons of them. That's how many claims are being filed. That's how much money's going on here. What about the marketplace? This is like the thorn in my side. I pay for my own insurance. I just want to go online, get the best deal. I can't. I got hijacked by the state. I got to go through the marketplace. So now there's limited choices, limited competition. I have to go through the state to almost pretty much communicate with my insurance company. That's my frustration. What are your thoughts on it?
Well, I don't work in that market. I have an insurance agency, and in that agency, we take care of individuals, and provide them with help in purchasing their marketplace plan. But what I'll say about the marketplace is you have both a federal marketplace, which the federal marketplace, most states use the federal marketplace. They don't have their own state marketplace.
Hmm.
State marketplaces, I'm in Kentucky, and we do business in Ohio, Kentucky, Indiana as far as marketplace plans go. I quit. I quit doing business in Kentucky because Kentucky 2 years ago moved away from the federal marketplace, which for the most part their technology is worked out and it works. But they went to their own website, they built their own service, and now I have clients calling me back saying, I wish hadn't gotten out of this. We spent 2 days, 2 8-hour days on the state of Kentucky website trying to get our single marketplace plan coverage in place. That's how convoluted the technology is. It's
And you
different
just
in every state.
you just addressed it. There you go.
Yeah,
One
it's
would
different
think.
in every state, and that's that's a big reason I don't want to get into that anymore.
I totally understand it. And what you said echoes my frustration, at least in the state of New York. And when you say federal marketplace, that doesn't mean, and I'm asking a question, that doesn't necessarily mean that if you're an individual, you want to buy insurance, that you can go to a federal portal for it. Am I understanding it right that a lot of states pull from the federal portal to provide their insurance in their own branded market space? Because I'd be happy to try a different one like the federal if I can go there instead of New York State.
Well, Steve, good news. You don't have a choice.
I never, yeah, I didn't want to hear that, but I kind of knew that, but yeah, yeah,
Yeah, you
okay,
don't have a choice. If your state has their own marketplace solution, you have to go through their website and purchase their plans. Now, they're all under the same ACA federal guidelines, the same law.
sure,
So the plans are essentially the same as far as benefit structure are concerned. And you have your silver, your bronze, whatever they're calling it.
yep.
Those are choices. You have all of that. But again, I want to help the employers that are providing group health insurance. They're probably looking at, on the average, a 24% increase in cost this year. And the federal government, HHS, Health and Human Services, they've identified 25% of healthcare cost is fraud. They've identified that in the marketplace, in the private marketplace. Now, when I say we use the word marketplace, it's using the same word in a different context. Because I'm talking about the self-insured marketplace, not the ACA marketplace. So what my company does, Advanced Benefit Design Institute, let's just say I'll use a Kleenex type term, a generic term, and call it claim auditing. We get into every claim and audit it. Now, I don't actually call it a claim audit. I mean, if you were to Google the term, that's what would get you to me. But our service is way beyond claim auditing. We're like next generation, or whatever you want to call it in that regard. We actually call our service a retrospective medical claims review. And for the groups that have over 500 employees, we actually recover this money that, my word, stolen from the benefit plan. The marketplace would call that overcharging, but I call it theft because it's by design. It's by design. It's a deliberate act that accomplishes overcharging of the bill. I mean,
Wow.
we've seen hernia bills come in at, $59,000. This procedure without complication should be under 10,000. So we identify this in the claims data, and then we contact those providers, and then we tell them that they have to write a check back to the plan sponsor. The plan sponsor is the employer. So, in that particular scenario, we're going to recover 40, 45, $48,000 out of the 59,000 that was taken from that employer's plan.
Wow.
That's what recovery means. That's what we do. Can you do
Hmm.
this on your own? Probably not. First of all, you're not even going to be able to crunch the numbers. You're not going to be able to go through your data. And the data is all coded with numbers. There's over 90,000 what's known as ICD-9 codes. These are procedure codes. And you might have 5, 6, 10, 12 procedures or codes per procedure. There's no way an employer is going to be able to data mine, decipher, identify this stolen money, this overcharging, fraud, abuse, whatever,
Wow.
it all qualifies. All those words work.
I want to center on the abuse. Where does that come from? Or is that the medical providers, just fudging or stuffing more in terms of codes and billing for it to see if they can get away with it?
Yes.
Wow.
Yes. Now, when you say medical providers, to me, you're talking about the doctors, the physicians, things
Yes.
like that. The overcharging is really not coming from them. And remember, they are now owned by the hospital as they are now employees of the hospital. So, there's very few independently owned doctors' offices out there. Now, there's a trend moving towards concierge medicine where doctors are now leaving those arrangements and putting together like a private list of patients
Yep.
under the name of concierge medicine. But for the most part, it happens in the hospital, and that goes back to what we earlier said when I mentioned bundling and unbundling of bills. That's where they pile on. Well, all these codes exist, but when you take all the discounts away because it's one procedure, oh gosh, I just had a mind flash here, I guess, something like that. There was a bill that we just adjudicated last week, re-adjudicated. Guy had his leg amputated. Okay.
Hmm.
Guess how the bill came in? First, they did a toe amputation and billed for that. Then they had a foot amputation and billed for that. Then they had a lower leg amputation and billed for that. And wait a minute, wasn't this just one procedure? They took his leg off and
Wow.
attached to his leg was his calf, his foot, his toe. Yeah, but they unbundled it and billed it as 6 or 7 different procedures. He had 6 or 7 different amputations.
Oh,
That bill was over $512,000. By the time we finished our review of that bill, our retrospective review, that bill was 122,000. The
unbelievable.
employer paid over 500. So
Unreal.
we recovered almost 400,000, over $400,000 on one claim.
Let me ask you this, Scott. Scale of 1 to 10, 10 being this overcharging, this fluffing, this all of this that's going on. I don't want to call it fraud. I'm just, the way it's being billed, shall we say. Scale of 1 to 10, 10 being absolutely intentional, and 1 being, it just slips through the cracks. That's it. Somebody made a mistake. Where would you put that at? And just in overall, just your overall view.
Well, Steve, I think you can answer that question based on that little explanation description I just gave you. Were
Mm,
they billed for a toe amputation, a foot amputate? Do you
yeah.
think it was intentional or is that was a mistake?
In that case, that's a 10. Yeah,
I,
without a
I've got
doubt.
another one. This was on the orthopedic side, and it was a knee replacement. And we're looking at the bill, and it was like $200,000 or $300,000 too much. And we got the lab notes, which is something an employer's never going to get. You're not going to see what happened in the surgery room. That's where the lab reports exist. And in that, we discovered they billed for like 110 surgical screws.
Hmm.
These are nothing special about them other than they're, a special metal and they're sterilized. But that's it. But how do you put 110 screws into one knee? Well, when we looked at it, we discovered that they had a container of these, sterile surgical screws that got knocked over and spilled onto the floor of the operating room. So they ended up billing that patient for all of those screws.
Wow.
And there's something known as auto adjudication. Auto adjudication is how these claims are paid. Now, I can go back a few years when we all worked on paper and describe how this works easier to understand when I describe it on paper. It's all digital electronic now, but what happens is the procedure's done. The bill is made up by the administrator or the billing department of the hospital. It's put in an envelope. It's mailed to the claims department. It gets to the claims department. A machine will open that letter. A machine will grab that bill and run it through a scanner.
Hmm.
The scanner connects to a printer. The printer automatically prints a check out. That goes to another machine that folds it up, whatever, puts it in an envelope, and mails it to the provider. No human hand has touched it. No oversight, no review, no checking.
Wow.
Whatever was sent in is paid. That's auto adjudication. That's what that process is called. So when you have auto adjudication, well, nobody's checking anybody. And the payments are just made based on how they're submitted. And if they're submitted with errors, whether they're a mistake or intentional or any other description you want to put on it, they're paid. Now, whose
Unbelievable.
money is that? That's your money. That's the employer's money. This group is self-insured. This money is coming from the employer's bank account.
Scott, 120 screws being billed for somebody is getting screwed. Uh,
Well, guess what happened to those extra 110 screws that they didn't use? They re-sterilized them and used them on the next procedure. They
I,
didn't
s-
throw them away.
I started this conversation saying how broken the healthcare system is, and there's, things slip through the cracks, and it's crazy. You've taken it to new levels here today and just illustrating why companies need to get these audits, have somebody look at all these overcharges. Scott, we're just about out of time. If this is resonating with somebody and they really want an advanced look at what's going on, how do they engage you? Is it a free consult? How does it start?
Well, visit our website, TheABDI.com. Stands for Advanced Benefit Design Institute.
Yep.
My direct line is what I give out to everybody, and it's 513-720-4400. Not only is it my direct line, it's also my cell phone. Okay, so it hits me anytime you want to talk. What we do, not only is it a free consultation, that I'm a consultant, and I wrote a book on that, Healthcare's C-suite solution. We were #1 bestseller in Amazon back in October. But anyway, I go beyond consultation. I will do the deep dive. I will do the audit, the retrospective review of all your claims. If you're a group with 500 employees or more, we'll go back 3 years of paid claims and audit all 3 years for free. Okay, we'll find all of these overcharges for you, and then recover this money. And this recovery is for the employer most significantly, but employees also have money that gets returned because they're paying deductibles, co-insurance, so on and so forth. They're overpaying too. So we recover money for both the employer and the employee. I get paid because we are successful in recovery. So we share in the recovery. But other than that, I don't charge anything for employers to do this retrospective review or claim audit, whatever you
Wow.
want to call
This is a no-brainer, especially since you're not getting
it.
charged unless money is recovered. Uh, Fascinating. Scott, great having you on here. Thank you for the insight. Learned so much. Uh, if you're a company that's in that position, take back your power. That's what it comes down to. Scott,
Yeah, call me. Call me anytime,
yep.
513-720-4400.
Thank you for being here today.
Thanks, Steve.
We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.